A patient discusses her relief of chronic depression with Dr. Winter.
When I first came, I thought I was coming to a chiropractor where they would adjust my spine. That's what I thought.
Right. And what?
Well, you tested my muscles, and I think I held strong on 2 muscles, which I knew I was not in the best physical condition, but I didn't realize I was that bad off. So in the process of trying to clear my migraines, other things came up, and we cleared those as well. I had lived with constant postnasal drip. I just thought it was who I was and what I had, and it's gone now. My skin is clearer, and the whites of my eyes are whiter. It could be from not taking all the Motrin and Goodies powders and things like that for my headaches. I'm happier overall. I have a history of depression where I've had been on Effexor and Prozac, and this past November of 2012 I decided I didn't want that anymore. I was not going to take I've never been an advocate just to take a pill to fix something. So I quit taking the Prozac in November, and then I went back to a psychiatrist, and I was like, look, I need something. And this was probably in April or May. I did not like the way it made me feel. And so now, this is the first time since 2011 that I've not been on any kind of depression medicine.
Wow.
And you didn't even know that.
Yeah.
Yeah. I mean, that's something I didn't share, so.
So how did you come off it? Did you talk to your doctor about that?
No.
How and why did you come off?
I came off of the Effexor because that's just not what I wanted for myself. I didn't want just to take a pill to make everything better for me, because I knew there was something at the root, and I didn't want just to cover up the symptoms. And for me, when I take medication, I gain a lot of weight. When I take like depression medication, I gain a lot of weight. So I had to draw a line and say, okay, I'm not going to do this anymore. There's got to be other alternatives. So I just did that. I mean, I weaned myself off. But I mean, my whole family has a history of depression, so it was not anything new for me.
So what do you guys?
I were to explain it, because when I first came, I didn't say I'm here for depression. It was a side effect of me coming for the migraines, is that my depression is well cleared up through the muscle testing and the meridian flows of energy. You could tell that if they were blocked. So you cleared those up, and now this is my thought process. If I have a migraine, or if I have something going on, my body's focusing on one thing, and it can't really clear all the things at one time. So now that my body doesn't have to focus on the headache all the time, then it can focus on other things, and I can handle it, take care of it, and get rid of it. Like I said, my family, both my parents are on medication for depression. My dad is bipolar schizophrenic. My mom is just clinically depressed. And I've always been more of a depressed person than upbeat, high energy. And that's who I am. But certain things would happen in my life, and I could not cope. My oldest daughter, I raised her for 16 years, and her dad wasn't in her life. And when she was 16, she decided to move in with her dad. And that sent me into a deep spiraling depression. And that was in August of 2011. And that's when I started the Prozac, and I was on 40 milligrams of Prozac a day, plus a mood stabilizer, which was Topamax. I gained 90 pounds on that medication, and it made me numb to the pain, but I still wasn't coping, because I would be driving down the road and it would just come over me, and I would have days, weekends, weeks that if there was one instance that it was her homecoming one year, and I wasn't invited to help her get ready. She sent me a text message telling me she was blocking me from her life. That's not an easy thing for any parent. But especially when I was depressed. Yeah, it was like a knife in my heart. So, but But now I still have those issues, but I know that that's her choice. And me crying and days of being in bed, I've got other kids. I've got a husband. I've got other things that I have to do. I can't just stay in bed. So, and I think before I came here, even though I knew that in the back of my head, I could not physically say, okay, I've got other kids. It took precedence. My depression took precedence over anything else in my life.
Is it now about depression, that kind of thing? You're laughing more and doing more activities without being concerned about it?
Oh, absolutely. Yeah, I don't have the irritability, the mood swings, the just the weepiness, days laying in bed crying. I mean, other than having the migraines, I dealt with the depression too. So I don't have that. I don't go to bed at 8 o'clock and wake up at 7:30 anymore. I'm not sleeping as much. I mean, just all around. I mean, I'm able to cope, if that's a good word. If something happens, I'm like, okay, well, I can handle this and I can move on. And now it doesn't at all. I'm not depressed.
Good job.
Yeah.
So if you or someone you know suffers from depression, call 770-536-6600.